pain or numbness in your arm? Maybe it's thoracic outlet syndrome, huh? Not every complaint in the arm is a disc or carpal tunnel. Hey folks, I'm Dr. Jeff Williams with Creekstone Integrated Medical. I'm the chiropractic orthopedic specialist here, and I want to talk to you about something that never really gets mentioned, but it's more common than you might think it is. Now, I promise, you're going to want to share this. Help us get the message out. We really do watch and pay attention, and we really appreciate those who are helping us and helping their family and friends. When patients come into our clinic with pain, numbness, tingling, or weakness into an arm, hand, or fingers, well, they have usually already visited Dr. Google and determined that they must have carpal tunnel syndrome. And sometimes they're right. Lots of times, they're not right at all. There's a chance, well, it might be a little known condition called Thoracic Outlet Syndrome, also known as TOS. Now, some symptoms of TOS are when your fingers or hands fall asleep while driving or typing, fixing your hair, or doing certain movements at the gym. Some of the most common reasons for issues into arms, hands, and fingers are maybe a disc issue, which is originating in the neck and going down into the arm, hands, and fingers. Tennis elbow, and as we mentioned, carpal tunnel syndrome. Those are a few of the common ones. TOS, however, is less common and not on many providers' radars. So people that have thoracic outlet syndrome, they're not always diagnosed with it because it's not that common. Now, what is thoracic outlet syndrome exactly? Well, everything that makes your arm, hands, and fingers work comes from your neck. Everything in your neck gets out to your arms, hands, and fingers through three really tight spots or bottlenecks, if you will. They are the scalene muscles on each side of the neck, the costoclavicular space just under the collarbone, and then there's the pec minor muscle under the collarbone towards the shoulder. And when these spots get even tighter for a variety of reasons, well, it can put pressure on really important nerves and or blood vessels that run through the area. Roughly 90% of thoracic outlet syndrome cases are compression of the nerves rather than the blood vessels, though, thank goodness. Now, interestingly, another common contributing factor to TOS is the presence of a cervical rib. Only about 1 in 500 patients have this genetic anomaly, and some folks with significant TOS symptoms with the cervical rib will opt for surgery in those cases. Now, how do we treat thoracic outlet syndrome here at Creekstone? Well, we've got medical, chiropractic, and a rehabilitation clinic. And so we start with a very thorough exam. There's not just one single golden orthopedic test that can identify TOS reliably, but a cluster of 2 or more of these orthopedic tests can give us about a 90% chance of getting to the correct diagnosis. And that's excellent odds when you're talking about odds in the medical world. Now, once we are confident in the diagnosis, we can then begin a schedule of conservative care for 2 to 4 weeks that includes manual therapy, massage, and evidence-based, research-proven exercises that are simple but powerful in helping our patients get their lives back to normal. The excellent news is it is very common for our patients to resolve and get to feeling better relatively quickly without surgery or pills. And if you're having issues into your arms, hands, or fingers, call us at 806-355-3000 and let us help you figure out what it is, and then let's work together to get rid of it once and for all. Even if it's a disc, even if it's carpal tunnel, thoracic outlet, we got it all. And if you're watching us on social media, subscribe, share, comment, and like, and all that good stuff. We appreciate it. And your family and your friends appreciate you caring about them enough to share the information. Until next time, stay smart, and we'll see you then.